Hey, Margie here. If you're ready to learn something new when it comes to an integrative approach to osteoporosis treatment, then you are in the right place. Recently, I had a live Q&A with my community, and our guest was Dr. Kim Millman, and she answered so many questions and shared so much wonderful information that I decided to share this with my podcast audience as well. So that's what today's episode is. And our special guest is Dr. Kim Millman, who's a Stanford UCSF USC trained functional medicine physician and research scientist. She has over 30 years of functional medicine training and has been specializing in integrative osteoporosis management for over 15 years. Her methods have a proven track record of 99% fracture prevention for over 600 patients. And the questions people asked were fabulous, and she gave so many tools and resources in this Q&A that I'm really excited for all of you to hear it. So enjoy. Before we start, I'm just going to make a disclaimer that the information presented, it's not meant to be medical advice to replace consultation with your physician or healthcare provider. What does a high NTX mean, and what do you do about that?
Okay, so NTX is, I think it's N-teleopeptide. It is a bone breakdown marker like CTX. CTX is the one that I use in my clinic, which is C-teleopeptide. The difference being is that CTX is in the blood and NTX is in the urine. And so what both of these peptides are is that when the bones break down, there are collagen fragments that are released into the blood, and then NTX is excreted in the urine. So we measure the particles of NTX, and then we measure the particles of CTX in the blood. And so what to do about it? Well, this is kind of a big question. There's kind of no real simple answer, except for really to discover why your bones are breaking down too fast. And so when I think about this, I have a framework for what are the root causes that would cause high breakdown, and what would be the root causes that would cause low bone formation. So we'll just go into bone formation because it's a much smaller list than high bone breakdown. So some of the deficient hormones, progesterone and testosterone, DHEA, and then some of the bone-building nutrients like calcium, magnesium, potassium, vitamin D, vitamin K, boron. I'm sure I'm missing a few. B vitamins are also important for bone building. And then, of course, exercise. So all of these things, if you're deficient in these things or you're not exercising enough, these will cause a decrease in the amount of bone formation. And I like to keep them straight because I measure bone breakdown and bone formation. And when bone breakdown is high, I concentrate on these bone breakdown root factors. So I would say that the biggest one, which is the biggest needle mover on bone breakdown, is low estrogen. And you'll notice that the other hormones were in the bone building category. Well, estrogen is in the bone breakdown category. So estrogen is our anti-resorption hormone. It causes when we have low estrogen, it causes our bones to break down more often. And so any kind of support around estrogen, it could be mild support like DHEA or maca, or even boron can be estrogenic. And then there's bioidentical hormone replacement therapy. So then high cortisol. So high cortisol can make our bones break down too fast. We know this because cortisol is our natural form of prednisone, and we know that prednisone causes rapid bone breakdown. And when your thyroid hormone is too high or your parathyroid hormone is too high, this can cause rapid bone breakdown. When you have a lot of inflammation, because inflammation It's interesting because a lot of our bone cells are actually derived from immune cells, and they are very responsive to immune signals that are in the body and inflammatory cytokines. These are the cell signaling molecules that tell our immune system what to do, and it also provides this environment of either bone breakdown or bone formation in our bones. Food sensitivities, they're inflammatory. They also cause immune chaos. And this can cause high bone breakdown. Toxicity can do so in a similar fashion than inflammation. A bad diet, so sugar, processed foods, trans fats, these are all things that are anti-nutrients, and they pull the minerals, especially sugar, and oxalates. Oxalates are anti-nutrients. So those will pull some of the minerals and vitamins out of our bones that we need so dearly. So oxalates can deplete our calcium, magnesium, potassium, zinc, iron, and some of our B vitamins. Blood sugar dysregulation. So these, and I'll talk a little bit about, we have a question specifically on blood sugar, so I'll get to that in a moment. Dysbiosis. So dysbiosis causes systemic inflammation because if we have a leaky gut, then some of these molecules from the bad bacteria can translocate into the blood and cause immune chaos. Mold toxicity, stealthy infections like Lyme and chronic viruses. I know this is getting into the weeds. And then acidity. So acidity is like sugar. It depletes the minerals. So of course, that's my framework of what are bone breakdown root cause factors and what are low bone formation root cause factors. So if you see your CTX or your NTX is high, you focus on bone breakdown. And then once you have a treatment, a natural treatment protocol in place, you do that for about 3 to 6 months, and then you remeasure either your CTX, NTX, or P1NP is our bone formation marker. You remeasure that and you see how your treatment program is going. And so what I say to everyone is that when you look at root cause factors, it is almost always multifactorial. There's not just one thing. There's many things usually. And then all of these root factors are really unique to you. Now, I will say that there is a product by Metagenics. It's called Ostera, and it has tetrahydroisoalpha acids in it and berberine. There's a little bit of vitamin D, a little bit of vitamin K in it, and it has clinically been shown to reverse bone breakdown markers, but it has the caveat that it's contraindicated for people who are on blood thinners and people who are on immunosuppressants.
I think it's really important to get into those factors because people really don't know. I think that, we can't overlook any of these things. If we're really going to be effective in our treatment, we really need to see what is happening. So I think that was such a great answer.
Okay. Yeah, and the body is complex, right? So it should be.
The thing about osteoporosis, and it's not a quick fix. That's the whole point. It really isn't. And, we wish there was a pill for every ill, and we wish we could just, okay, it's so simple, but it isn't. That's why I love the way both of us practice. And I love what you do, because once we look at it, what's causing the root factors, and let's really dig deep and figure this out, people get better. That's what's so amazing. And people can live long, healthy lives feeling great. And so, as I always say, a diagnosis can be a blessing in disguise, because all the good things that you're doing for your bones also help your body. Okay. On that note, question number 2. If you break a leg, and again, these questions, I'm very impressed with all of you. If you break a leg and are struggling for the bones to knit, what are the best bone-building foods, minerals, and vitamins, herbs, and spices to take to help the bone knit? That's what the person called it, the bone knit. So basically...
Okay, so one of the things that I do in my practice, one of the herbs that I absolutely love, this would be healing really any kind of tissue, including the bones, including a fracture. So it could be a wound, it could be post-surgical healing. I love this herb called Go-To Cola. And I use this in my practice a lot. And usually I'm going to start this. So there's a couple, I think there's a little bit of, I use a combination product from MediHerb Standard Process. It's called Go2 Complex. Go2 Cola Complex has got a little bit of ginkgo in it. So you have to be careful if you're really close to some kind of an injury or a surgery, because you want there's a little bit of blood thinning with ginkgo. So you start it around day 5 or so, and then use it, I would say, for maybe 2 months. The other thing that's really helpful is PEMF. So PEMF stands for pulsed electromagnetic field. Now, you may have heard that EMF is bad for you, and some EMF obviously is bad for you, but this is a electromagnetic frequency that is very healing. It actually happens to be the electromagnetic frequency of the gravitational pull on the Earth. So when the cosmonauts came back from the space station, they used PEMF to put a gravitational pull back on their body and to help them to recover from being in a zero gravity situation. It is FDA approved for fracture healing. And I have a very powerful 1.5 Tesla PEMF that was a $30,000 machine in my clinic. And I get very fast bone healing from that. But lesser machines can do the same thing. You might be able to find a practitioner in your area. PEMF is great for osteoporosis. So if you wanted to buy a $6,000 or $7,000 machine, Dr. Pollack is one of, the best experts in the machines. I would also do the simple stuff, which is get enough protein in your meals. Take collagen, bone broth. My favorite protein supplement is something called Perfect Amino. And Perfect Amino is a collection of electrolytes. And what's interesting about it is amino acids. What's interesting about it is that, so we make proteins with strings of amino acids. And so Dr. Minkoff, he's a pretty famous functional medicine doctor. He didn't determine this, but he used this principle that there are certain amino acids that are bottlenecks. So these are the ones that we don't get from food the most. And so he put those amino acids as the higher concentration of amino acids. And this collection of amino acids helps to build protein even better than food does. At least that's what he says happens. So, vitamin C is in the collagen production pathway, so enough vitamin C and all the good building blocks, calcium, magnesium, potassium, vitamin D, vitamin K. Get good electrolytes, including potassium. Stay away from the anti-nutrients, the sugar, processed foods, trans fats, oxalates. And then some spices I might think about are anti-inflammatory, like turmeric and ginger and rosemary. And so, again, you're starting to hear the repetition of the same kinds of things, right, over and over again. What's good for building bone after you've lost bone is good to repair bone. But I would say that those two specific things would be Go2 Cola, PEMF, and I would probably throw Perfect Amino in there too for actual fractures.
Okay, that's great. Dr. Millman, who makes Perfect Amino?
That's from Body Health. It's Dr. Minkoff's brand.
Okay. This is another good question. And this is one that's near and dear to my heart, too. I wasn't aware of the link between glucose levels and bone loss, because I find people aren't even aware of it until it's like diabetes. A lot of times it's just completely ignored. Other than the obvious reduced sweets and sweetened beverages, can you talk about other strategies for lowering blood glucose? You're the expert at this. You have so many amazing tips, but if you could just share a few of them, that would be terrific.
Just having prediabetes with an A1C between 5.7 and 6.4 increases your fracture risk by 24%. So it's definitely a major root cause of bone loss. And these are two people with exactly the same DEXA scores. And so mechanistically, what happens is that the glucose attaches to the proteins and causes ages. And what is an age? An advanced glycation end product. And these ages literally age our body, age our bones. They make our proteins more brittle and more fragile, and they don't work as well. So I would say, so what you want to look at is your glucose spikes. So what do I mean by that? That would be, what is your baseline glucose? And then what is the peak glucose after you've eaten your meal? And the peak minus the baseline is your spike. You don't want your spike to be more than 30, or that is going to cause insulin resistance. What is insulin resistance? That is when it takes more and more insulin in order to drive the blood sugar from the blood into the cell. And insulin is inflammatory. So what are some of the things that you can do? There's some pretty easy, simple things. Of course, you're going to watch your carbohydrates, but one of the things that you can do is to do food combining. So that means to add protein, fiber, and fat to any carbohydrate snack or meal. And so what that's going to do is blunt your glucose spike, and you're going to blunt your glucose peak and spike. The other thing you can do is food combining. Food order. So there was this really interesting study that was done where they looked at insulin and glucose at different points after the meal. And they looked at, there was a ciabatta and orange juice for the carbohydrates. There was some chicken and broccoli and a small salad. And they looked at what were the insulin levels when they ate the carbohydrates first and when they ate the carbohydrates last. So when they ate the carbohydrates last and they measured the glucose at 60 minutes, it decreased by 37%, which I think is a huge number. And then when they looked at the insulin spike at 60 minutes, it reduced that insulin spike by 50%. So just by changing the order in which you're eating your food, and I don't think you have to eat your entire piece of chicken before you have a little bit of your rice, at least eating 4 or 5 bites, having most of your salad, a little bit of your vegetables, and then eating a little bit of your rice would go a long way to decreasing your glucose spike. So I think that is a huge thing to consider. The other thing you can do is take a 10-minute brisk walk after you eat. You can try a tablespoon of apple cider vinegar, and you put that in a little bit of water 20 to 30 minutes before carbohydrates, and you can decrease your glucose spike that way. The other thing that really increases glucose is stress. So you absolutely don't want to be eating under a stress condition. And then the other thing is to use a continuous blood glucose monitor. And I think that the information that you can get is so valuable from this, because if I eat a raspberry, my glucose spike might not be too high, but if Margie eats one, hers might be too high. And you really don't know until you test. And you might be surprised. And you can test all of these theories. What happens with food combining? What happens with food order after I take a 10-minute brisk walk? What happens if I do a high intensity exercise routine? A lot of times your glucose will spike pretty high and then it will come right down. So I think that doing a continuous blood glucose monitor is really super valuable. And I say that it usually takes about 2 months to gather the data to determine what are those foods that you really should just stay away from for a while. And even longer than 2 months would be helpful. And of course, there are some other things like zinc. There's a lot of research that zinc helps. So I would be looking at 15 to 30 milligrams of zinc a day. Berberine, there's some data to show that berberine helps about 500 milligrams twice a day. Cinnamon, chromium, there's an Ayurvedic herb called gymnema that there's some things that show that gymnema helps with glucose and A1C. And there is metformin. And I don't think that metformin is a terrible drug, especially in a transition period. Then if you want to go to the extremes, there are the peptides, which are semaglutide and tirzepatide. These require prescriptions, and they're under the brand names of Ozempic and Mounjaro. And they lower A1C, and they lower weight, and they lower they increase insulin sensitivity.
So I want to just comment on that because I couldn't agree with you more. I know I saw my blood work and my A1C was 5. It was getting up to, it was like 5.7 at one point, and it's never been that. So I immediately got the blood glucose monitor. And it was amazing. It was just so amazing to figure out. It's so different. And my husband and I both did it at the same time. And it was just so incredible to see what food, it was so different. It's so different for everybody. But, sometimes you have no idea what could be jacking up your blood sugar or your favorite restaurant, the dressing. Who knew it was like totally full of sugar? So it was just fascinating. And the tips you gave are so good because there's so much that you can do. I was able to easily get it to a good level, and it's really never been, but it was the knowledge I got from that was so very helpful. Okay, so this is a similar question, but you may want to comment on someone with a high CTX of 869. Are there supplements that will help lower this number? I lead a healthy lifestyle.
Yeah, again, I think this is similar to the ones that we answered above. Again, we have Ostera to decrease CTX. And I think that supporting hormones in either with DHEA, maca, boron, even doing bioidentical hormone replacement therapy, if that's right for you, because I think that that's the biggest needle mover on CTX is low estrogen. And we had a program member, and she was on bioidentical hormone replacement therapy, and she looked at her CTX, and her CTX was high. And then in the class, I go through and I give this is all based on data. I give the ranges that are best for bone health. And she wasn't in that range. So she increased her estrogen, and she remeasured it after 3 months, and her CTX came down. So yeah, we really see that it's really a big needle mover is estrogen.
If you eat a spinach salad, this is a good question. All the questions are, if you eat a spinach salad for lunch or eat overnight oats with chia seeds for breakfast, how long after the spinach salad or chia seeds should you wait in order to be able to absorb the calcium from a glass of milk?
Well, I will just say that I don't know the pharmacokinetics of oxalate bindings and absorption. I don't know that data. But I will say that a spinach salad for just a half a cup of spinach is 766 milligrams of oxalates. And we really can process about 250 milligrams of spinach. And so if you eat spinach, I would say eat it sparingly. And how long would the spinach be in the GI tract? Because it would have to be, the oxalates would have to be in the GI tract to absorb the calcium from another meal. I would say that they would need to be in the large intestine, and we would have to know your transit time.
Yeah, it's not an easy question. I guess the important thing is that, those are high oxalate foods, and we've gone into that so much about oxalates, and I can't get over. You want to just share? I know you've shared this before, but since I was part of the program, I could not believe all the people who got better, other symptoms got better when I know you've talked about this on the summit, and, when they stopped. You want to just share like one of them or two of them?
Just
incredible.
Briefly.
Yeah.
One of the participants, 90% of her neck pain that she had chronically, and she was a chiropractor, went away. And her chiropractor was amazed. She told them that she took oxalates out of her diet, and they were so surprised. And then another woman, she had chronic UTIs, and sometimes she would do culture and they would find bacteria, and then she would go on antibiotics. And other times they didn't find any bacteria, and they were like, well, maybe we'll just give you antibiotics. She had been going through that for at least 5 years. And so she took oxalates out of her diet, and this urinary frequency and urinary irritation and urinary pain that she had went away completely. And then another participant had very sore and kind of heavy legs, and so she wasn't doing as much exercise and wasn't doing as much activity. And then she took oxalates out of her diet and really improved. And the other thing that they didn't just take oxalates out of their diet, and you have to be careful when you do it too. And we go into this in the program, but they repleted the nutrients, the number of nutrients that are important for the bones that oxalates bind to is incredible. So calcium, magnesium, zinc, potassium, iron, B vitamins, especially B6, which is a calming B vitamin. So I have them do an electrolyte drink, which I like. It's called 40,000 volts, and have them take a teaspoon of the electrolyte drink, put it in some water. And citric acid is very good for combating oxalates as well. So half of a lemon juiced into water, they drink that over the day, and they take some P5P.
Great. All right. Can you suggest the best collagen for bones? Is it important to buy a collagen that's organic? And is it important to have Fortibone listed in the collagen?
Okay, so obviously it would be great to have the collagen be organic. And because I recommend Perfect Amino, I don't know much about all the different collagens that there are. But I think that you know a little bit about the Fortibone, don't you?
Yeah, I mean, that's the one that I use because it has been studied and they have shown a relationship with bone density. So there's research on the Fortibone. And I like the designs for health. Plus it's easy to, but I have never tried the Perfect Aminos, but so I've been using this for years with so many people, but it's easy to drink it. It doesn't clump up. It doesn't have a taste in it. But the main reason that I chose that, I mean, I like the company as well, is that it contains Fortibone and two other compounds that have been shown to help with bone density.
So is that the whole body collagen from?
Yeah, whole body collagen by Designs for Health. Yes.
Yeah. Someone else in the program said that she used it and she loves it.
How to get doctors to work with us to try to find root causes. And this is the problem when you become knowledgeable, which is really good. It's a good problem. But what's the conversation like? I'm not having luck here. I feel like I was fired by my current endocrinologist because at the moment I'm refusing drug treatment until I find out more about the cause. Good for you. He said, we know the cause. You're a postmenopausal female with a familial history of osteoporosis. That's it. No further testing required. If I'm not willing to take drugs now, he can't help me. I feel very dismissed and wonder if I could have said something different to get more help. He did order a few of the tests I asked for, but is not willing in seeing the results or seeing me again since I won't take the drugs. Okay, Dr. Millman, what do we do? Find a new doctor, right? That's my thought.
Yeah, I mean that's going to be probably the thing that I'm going to say is in that situation to find a new doctor. But I do think that maybe the conversation could hopefully be a little bit more two-sided if you started not absolutely coming in and saying, I do not want to take any medications. I think that right there is the first thing that you should never do. First of all, you don't know if you need medication. You don't know if medications are really the best thing for you. And in fact, I had a patient a week or a couple weeks ago who came in and her spine was at a negative 4.0. And I told her, you have severe osteoporosis. Like even if we do BHRT, which might add another 7%. You do strength training, you might add another 5%. You're probably not going to get that into the negative 3.3, negative 3.2 range where it's going to be and keep it stable for the rest of your life. And I have to say that since I have been listening to Dr. McCormick, you introducing me to him on the summit, I've really changed my view quite a bit about medications, that I didn't really realize that it could be a short-term situation. I didn't realize that you could one of my patients built like 18% of her bones back with using Evenity. And she did that. And now she's on alendronate. I think probably, maybe IV Reclast would have been better, but she decided that. And now she didn't have to worry about her bones. She just needs to keep them stable. And although I think all the root cause factors need to be done as an absolute minimum, it's never going to compare to a Forteo or a Tymlos or an Evenity, right? In order to reverse. So I think to keep an open mind when you speak to your doctor about it is really important. And I also think you go to doctors for what they're good at. An endocrinologist, if there are any endocrinologists in the audience who maybe have a different specialization than the ones that I know of, but that's not their job. It's not their job to figure out what the root cause is. It's a functional medicine doctor's job to do that. A little bit of testing on bone markers and some other things like that, but you want them to go deep into blood sugar and deep into inflammation and deep into diet and anti-nutrients and oxalates. That's not what they're trained for. So I think your expectations should be at a certain level. And that's, maybe they'll do a few bone turnover markers for you. Maybe they'll do these are what I would say an endocrinologist markers they should be looking at. They should make sure you don't have hyperparathyroid disease, so PTH and calcium. They should make sure that you don't have a renal leak, so 24-hour urinary calcium. And if they're forward-thinking enough, doing a CTX and a P1NP. If they're not forward-thinking enough to not do a CTX or P1NP, maybe you don't want them on your case anyway, because you really do need those markers to show the medications are working.
Yeah, I couldn't agree more for a couple of reasons. What I also learned from Dr. Mo, first of all, nobody wants to fracture. Our end goal is to live a vibrant, wonderful life and active as we age. That's what we all want at the end of the day. It's not the number on our DEXA. And so there are situations when whatever has happened has compromised your bone health that you really are at high risk for fracture. So short term, like Dr. McCormick taught me, short term use of these medications while you're looking for the root cause, while you're doing everything else, can sometimes help you through that period, and then you can move on. But I also think that you want this team. You don't want someone who's yelling at you saying, absolutely not. And sometimes, when you want the root causes, again, I agree with you, by just saying, the truth is, though, I don't think they mean harm. I just don't think they've learned this other. They're not a functional medicine doctor. This is what they learn and this is what they know. And I have found that people have been very open if you ask for the CTX and the P1NP. Sometimes they'll say, I don't think it's accurate. Well, the reason it might not be accurate is the time of day it's taken. It has to always be at the same time. So I think if you ask them, and explain why, I really want to see my bone breakdown or whatever, I typically haven't had many problems. But, I think, just like you said, the person on your team, you want them for their expertise, but then you also want but know what they are, so you can have someone and a functional medicine doctor, or you can sort of figure out your team. But you have to feel good about them at the end of the day. You have to feel that they're part of your team and they want you to succeed, and they're on. If you feel tense, and then it's time to switch. Okay, I could talk about this for hours. Are you okay for a few more questions, or do you need to?
Sure.
Okay, but that was that question is asked by so many people, and it is frustrating, and we feel your pain. That's why.
But really, I think that you should have certain expectations of what you're going to get, right? Mm-hmm. And that you shouldn't expect them to be able to give you a matrix like I did. What are the root causes for low bone formation, and what are the root causes for high bone turnover? You shouldn't expect them to do that, because like you said, they're not trained.
It's very hard to get 1,200 milligrams of calcium every day from food. Is it better to take 600 milligram via supplement than not meet the 1200? Is it safe to take calcium supplements if you have kidney stones?
Right. So those are a lot of the things that I talk about a lot. So I don't use 1200. I don't use the RDA of 1200. I back down from that a little bit. So I recommend 1,000 milligrams being total from food and from supplements. So again, you do something like chronometer and find out, do an estimate of really what your food looks like. Out of those foods, take out the high oxalate foods, the spinach, beet, chard, rhubarb, beets. You take those high oxalate foods out, and then you, whatever is left from 1,000 is what you should supplement. So a lot of people can get 400 milligrams of calcium from their food. That leaves 600 milligrams, and from Designs for Health, that would be 600 before capsules, and you never want to take more than 300 milligrams of calcium supplements. 350. You don't want to take more than that together at the same time. And the reason is because of the absorption fraction. Okay, so let's say if you take 1,000 milligrams at a time, you will absorb 21% of it. And then if you take 300, 350 milligrams at a time, you will absorb 31% of it. So there's a 10% increment in what you will absorb. So you really want to only take around 350 at a time. And with Designs for Health, that would be 2 capsules in the morning, 2 capsules at night. And that would be 600 milligrams, 400 milligrams from food. Was there another part of that question?
Oh, about the kidney stones, yes.
Oh, kidney stones. So kidney stones are really related to magnesium deficiencies, and also I would say high oxalate diets. So what I would do is I would take as much of the oxalates out of your diet as possible. Increase the lemon juice that you bring in, maybe half a cup of lemon juice per day, and then make sure you get adequate amounts of magnesium. And I think that all of those things would be helpful.
I can't thank you enough, Dr. Millman. This was great, and you put so much effort into these amazing questions. I hope you enjoyed my Q&A session with Dr. Millman and have some takeaways that you can put into your life. She is always so full of information, and I'm really thrilled that she's offering again her course, Restore and Rebuild 100 Days to Healthier Bones. As I mentioned, it's a class that I teach 2 of the modules, but I also went to all the classes last year. I did them as a replay, and the class is just phenomenal. It has so many resources, and it will definitely help you figure out your root causes as well as, help you implement an integrative approach that she talks about. So all the links to that will be in the show notes. And thank you so much for tuning in. And I look forward to seeing you on the next episode.